Hi, this is Dr. Carol McMakin with Frequency Specific Microcurrent. And today's presentation is designed to tell you how FSM is a new tool that will help you solve old problems for medicine and your practice. Whether you're a patient or a practitioner, FSM can be a tool to help you do what you want to do. Frequency Specific Microcurrent is it uses frequencies that were developed in the early 1900s. They were used by thousands of physicians until 1934. Everybody wants to know where I got the list of frequencies. Well, I got the frequencies from an osteopath named Harry Van Gelder, who bought a practice in 1946 that came with a machine that was built in 1922, and that machine came with a list of frequencies. George Douglas got those frequencies from Dr. Van Gelder in 1981, and we resurrected that list in 1995 and started using it to treat myofascial pain and myofascial trigger points. In 1995, 96, I started teaching FSM in 1997 to find out if it was reproducible. Our results in 1996 and 95 in myofascial pain and in chronic illness were so profound that I really had to find out whether the results were real or whether it was a placebo effect because the walls in the clinic were pink and I was a nice guy. So that's why I taught it in January of 97 for the first time. And by June of 97, we had enough practitioners who had purchased machines and taken the class that they could treat patients, and they were reproducing the results that we had in our clinic. The question always asked is, how did these frequencies come to be? How were they created? How did they decide what they should be? And the answer is we don't know. In 1917, the Flexner report came out, and physicians were told that anyone that used herbs, homeopathy, nutrition, or electromagnetic therapies would lose their license to practice, which at that time was granted by the AMA. So by 1934, that statement had been made. The machines went into the back room, covered up with sheets. And when that generation of physicians who did the original work passed away in the 40s and early 50s, everything they knew and all of that history disappeared because it had been destroyed and suppressed. So I have no idea. Mechanism of action, we're fairly certain at this point that the frequencies affect cell signaling by changing the configuration and the function of the cell membrane protein receptors. And that changes genetic expression in the cell and cellular function. The 1920s equipment was not microcurrent. It was a whole different kind of current. And that's what we know. So the old problems in medicine are healing injuries, surgical injuries, and healing wounds. So the repair limitations for the average patient and practitioner are ATP production. How much energy can the cell make to help itself heal? How do you increase vascularity and keep it within a normal range? How do you increase collagen and elastin formation to repair the soft tissue? When it comes to wound healing and injury repair, you have to ask yourself what would happen to healing if you could increase ATP production by 500%. And the basic science data that we have on the current by itself is that the micro-amperage current, so current below 500 microamps, increases ATP production, or the cellular energy production, by 500%. It increases protein synthesis by 70%, and that increases amino acid transport by 40%. So when you give the cell a virtually unlimited supply, or 5 times its normal supply of energy, what does it do with it? It increases more amino acids by 40%, and it increases protein synthesis by 70%. That came out of Nak Cheng's work in 1982. Seegers reproduced that work in 2001 and 2002, and she added to it the statement that the micro-amperage current increases cyclic AMP in human lymphocytes, and this was in vivo in living cells. And her hypothesis is, her observation was that it activates signal transduction. The references for those 3 papers are on the slide, and I recommend that you go and look them up. So microcurrent, the current devices, are approved in the category of TENS devices by the FDA. It doesn't seem to bother anybody that it's 1,000 times less current than TENS. It's millionths of an amp, not milliamps. There is a non-aesthetic, non-prescription use that is for estheticians and skincare specialists. So microcurrent is more or less the same, but if you're using it for skincare, it's not a prescription. And if you're using it for pain management, it is a prescription, and it's approved in the category of TENS. Good news, because it's approved in the category of TENS, is that it's billed as a TENS. So it's billed as a tended electrical stim, and insurance does cover it. It is billed as a physical medicine code. Microcurrent devices vary widely. When we started in 1995, there was one machine on the market. The Precision Micro had 2 channels. You could set 2-digit specific frequencies on each of 2 channels. We appealed to the manufacturer, and he modified that device to make it into a 3-digit specific unit. But in general, the microcurrent devices that are out there use 0.3 of a hertz, 0.6 of a hertz. It is direct current, which is battery operated. They don't plug in the wall. Although there are some units out there that will convert wall current into micro-amperage. So it's DC current or pulsed DC. The circuitry in the machines turns the current into waveforms. There are square waves, sine waves, ramped square waves. The old myomatic eye used a tsunami wave, which was basically a ramped square wave. The front end of the wave was sort of sloped to allow for easier passage of the current through the skin resistance. A lot of units have just 1 channel, just to deliver plain 0.3 of a hertz or 0.6 of a hertz microcurrent. Some machines have 2 channels. There are some combined units that provide ultrasound, interferential, galvanic current, TENS current, and microcurrent. The frequency in general in microcurrent is not important and hasn't been for years. Usually there's a limited number of frequencies, 0.3, 0.6, 30 hertz, 100 hertz, and 300 hertz are the ones that I've seen on the smaller devices. Or they'll do a sweep of frequencies. So the AccuScope sweeps from 0 to 1,000 and back again, more or less automatically, and there's only 1 channel on that unit. So those are the devices. They go back to the 1970s, and they provide microcurrent. And so what happens when you have just the increase in ATP production, protein synthesis? This study was done in rabbits. It was done in rabbits. The bunnies were biopsied before the study. Then they were treated for 20 days. So 5 days a week for 4 weeks. It was done at University of Washington. And it's unpublished data of rabbit biopsies. And it's unpublished because it was done for the skincare industry, which does not care about peer-reviewed papers. So you biopsy the bunny before the treatment, and you just run 0.3 of a hertz through their little paws, front and back, for an hour a day, 5 days a week for 4 weeks. And at the end of 4 weeks, you biopsy the bunny again. And what happened is that the vascularity, the blood supply to the muscle, increased by 39% in 20 days. The collagen increased. I don't know if you can see it on the slide, but it's the little black streaks. That slide is stained for collagen. That increased by 14%. And collagen is what gives you the repair for connective tissue. Vascularity gives you repair for vascularized tissue like muscle or soft tissue. Collagen is for the connective tissue, and elastin increased by 48%. Elastin is the kind of connective tissue that stretches, and it makes the new repair tissue more functional. It makes it stretchy so that it doesn't tear. It doesn't tear the tissue next to it, and it is more functional. So this is just what the current does by itself. So then we add to that the effect of the frequencies. So just based on the current, you have to ask yourself what would happen to injury repair and wound healing if you could increase ATP production, vascularity, collagen, and elastin especially by 48%. So the frequency effect, you add to the effect of the current. The current is important. The frequency effect makes a huge difference in healing. Unmodulated current increases ATP production, but the frequencies add an additional dimension to healing and tissue repair that makes a huge difference. So how do we know this? Denise Curtis did a study in Ireland on delayed onset muscle soreness. It was a controlled trial. So they had a treatment leg and a sham leg, and it basically compared non-specific current. This study was done by Allen in 1999, 0.3 of a hertz and 30 hertz for 20 minutes. So no frequencies, only one channel. That was Allen's study. And a negative trial means that it didn't work. It didn't do anything to reduce the pain of delayed onset muscle soreness or shorten the course. And so the original study was done with not frequency specific microcurrent. Both studies used 200 microamps, so the current was the same, but the frequencies were what were different. The frequencies we used are 18 and 62, it's the frequency to stop bleeding. 124 is the frequency for torn and broken tissue, reducing inflammation. Delayed onset muscle soreness is basically inflammatory. And then vitality in the muscle belly, the fascia, and the tendons. And in that study, what we found was that the treated leg at 24 hours, the pain in the treated leg was 1.3 on a scale of 0 to 10. And the sham leg, the placebo leg, was 5.2 out of 10 at 24 hours. The worst day in delayed onset muscle soreness is at the 48-hour mark, and the pain level in the sham leg was a 7, pain level in the treated leg was 1.2. Pain level at 72 hours was a 4.0 in the sham leg and less than a 1 in the treated leg. So p-value is a measure of statistical significance, and a p-value with 3 zeros is absolutely huge. It's like there's less than 1 in 100,000 chances that this outcome would be coincidental. There is no other effective treatment for delayed onset muscle soreness. So we have post-operative recovery data that just hasn't been published yet, but delayed onset muscle soreness gives us an idea of how the microcurrent works in new injuries. So it explains why it is that there are so many NFL players. There's over 200 NFL players that have their own custom care or sports care units. There are 6 or 8 NFL teams, several NHL hockey teams that have microcurrent, frequency specific microcurrent in their training rooms. And that outcome is why we help players recover faster, and in professional, Olympic, and elite sports, repair, recovery is the key to success. This is the post-operative outcome. The study was done by John Cale. He's in the process of having it published. He's an OBGYN, and these patients had C-sections. The FSM treated group got out of the hospital in less than 3 days. The control group that was treated with normal post-operative care got out of the hospital in 3 1/3 days. The pain level was the most interesting. Pain at rest was about a 2, about a half, like 0.5 out of 10 on a 0 to 10 visual analog scale, and it was about a 2 with opiates and normal post-operative care. The real trick was with activity. So the pain level with activity, walking around and doing the things you want to do for a patient to recover more quickly, pain level was a 2.7 out of 10 with FSM and a 5.4 out of 10 with the control group. In diabetic wounds, if you can see these photographs, this patient had a 7-centimeter wound on the left side of his leg. His legs were gray, and if you notice the swelling up here, his lower leg circulation was really quite poor. This case report was done by Nora Collier. She's a chiropractor in Texas. This patient had 6 treatments in 3 weeks that healed this particular wound on his leg, the 7-centimeter long wound on his left leg. If you look at this, the toe here, the second digit was necrotic, and it was actually scheduled to be amputated, that toe. They were going to wait for it to get a little worse when he went to see Dr. Collier to get treated. And it resolved completely in 12 visits. This third digit over here on the left foot, that resolved in 7 treatments. The other thing that you find with diabetic neuropathies is the foot gets numb and painful. So this patient had lost sensation in 7 out of 10 areas in the foot, and after 8 visits in 4 weeks. So the patient came in twice a week, 8 visits in 4 weeks. Sensation was normal and totally restored. The thing with diabetic neuropathies is that they treat the protocol, the FSM protocol treats the blood vessels. The problem with diabetic neuropathies is the blood vessels are inflamed and kind of clogged up. So the trick with diabetic neuropathies was that the first year we treated them, I didn't have any success. I was treating the nerve. Then I actually looked up what causes them, and it's the blood supply. And when we changed the frequencies to address the tissues that we have for the blood vessels, the arteries, that's when we started getting these sorts of outcomes. So if you know anybody with diabetic wounds, painful or numb feet, let them know that FSM is a good resource. Another old problem in medicine is inflammation. Inflammation is the primary cause of all degenerative diseases, cardiovascular disease, immune system activation, and anti-inflammatory drugs have some issues. They take too long to work, and it's 4 to 24 to 48 hours. And the problem is that there are too many side effects. The non-steroidal anti-inflammatories damage the kidneys and the heart and the gut, make the gut leak, create ulcers, and non-steroidal anti-inflammatory drugs kill 16,000 people a year at the last figures that I heard. In medicine, the cytokines which mediate inflammation and autoimmune disease, those are very hard to change. The drugs take about 3 months to work. And when they do work, they take the cytokines too low. And so the patient doesn't have adequate cytokine response to keep at bay problems like infections and cancer. So inflammation is a big problem in health and medicine. And as it turns out, the frequencies are very good at reducing inflammation. So lipoxygenase, LOX, lipoxygenase-mediated inflammation, was reduced by one and only one frequency combination by 62% in 4 minutes. It's a time-dependent response. Half the response is present in 2 minutes. COX-mediated or cyclooxygenase-mediated inflammation was reduced by 30% in 4 minutes, which doesn't sound quite as impressive, but it's equivalent to injectable Toradol, which is a drug they use after surgery to reduce inflammation. So it's 30%, but it's equivalent to a prescription injectable drug when it was tested by the same researcher in the same animal model. So this was the research done at University of Sydney by Vivian Reeve and Wayne Riley. They painted arachidonic acid on a mouse's ears, and that causes inflammation and swelling. And then they measure the swelling with these little calipers. So it's mechanical rather than chemical. And so they paint arachidonic acid on the mouse's ears. They got a 70% reduction in lipoxygenase-mediated inflammation, which caused Dr. Reeve to stop the study, because in 18 years of doing this kind of research, she'd never encountered any treatment that reduced inflammation by more than 45%. So she blinded everybody in the lab. She moved the people that were measuring the mice into a room, closed the door, people that were painting the mice into a room and closed the door. She went into the room with the man that was treating the mice, turned the machine away from him and put in a placebo frequency. And the frequency 40 hertz on channel A and 116 hertz on channel B. 40 hertz is to reduce inflammation, 116 hertz is to address the immune system, created a 62% reduction in lipoxygenase-mediated inflammation. And what that means is lipoxygenase-mediated inflammation is associated with every degenerative disease: asthma, irritable bowel, Crohn's, IBS, ulcerative colitis. All of the neurodegenerative diseases are LOX-mediated. Created a 30% reduction in COX, or cyclooxygenase-mediated inflammation. COX we associate more with joint and muscle inflammation. All of the animals responded, so there was nobody it didn't work on, and it was a 4-minute time-dependent response. So at 2 minutes, 50% or half of the response was present, and by 4 minutes, the full response was present. Further time spent on the frequency didn't make any difference. Then we wanted to find out, will any frequency do this? Will just the current do this? And the answer was no, unequivocally no. So 40 and 116 reduced inflammation, but the frequency, just 1/10 of a hertz on one channel, just a single channel, one frequency had no effect. It was equivalent to placebo. She used other of our frequencies, but they were for unrelated things like mineral deposits in bone, and that had no effect on ear swelling. There's a protocol we use that uses 294 hertz, 321 hertz, 9 hertz. That gave no reduction in ear swelling. And then the frequency to reduce inflammation in the skin, not the immune system, but the skin, that gave no reduction in ear swelling. So only one frequency combination reduced the inflammation. Then if you sunburn the mouse, I know, the poor mice. Anyway, if you sunburn the mice and you don't treat them, sunburn causes, as you know, if you've ever fallen asleep out by the pool, causes redness and swelling. That's worse at 27 hours. So these were measured at 21, 23, 25, and 27 hours. Then they treated one group of mice immediately, and that group had some reduction in swelling, but it wasn't statistically significant. A group that was treated at 2 hours, and that group had statistically significant reductions in swelling at all time measures, 21, 23, 25, and 27 hours. The p-values are reasonable, 0.01, 0.05. And if you've ever had a sunburn, you know how much you'd appreciate it if you could take it from painful and red and swollen to not painful and red and swollen by simply treating it for 4 minutes. Then there was another part of the experiment that was interesting and a little more complicated. A chemical called oxazolone, that's a contact sensitizing agent, was painted on the hind leg at the time of the UV exposure. Now, a sensitizing agent is something that your immune system is going to react to the next time it sees it. First time it sees it, it's not a problem. Second time it sees it, it causes a huge immune system reaction that creates swelling. So they painted the contact sensitizing agent on the hind leg at the time of the UV exposure. And then 2 weeks later, that same agent was painted on the mouse's ear. So a normal response to this contact sensitizing agent would be, in the non-sunburn mice, would be this purple bar here. It's like 30 units of swelling. If you sunburn the mice, sunburn has the effect of suppressing the immune system response. And in the sunburn untreated group, the swelling to oxazolone, when it was applied the second time, was suppressed by 63.4%. So it was suppressed by 63%. And that's the effect of sunburn. They use it as a measure of immune suppression. The group that was treated at 2 hours, that had the best reduction in swelling, if you remember, had their immune suppression reduced from 63 to 57%, which is nice. Good reduction in swelling and a slight reversal of immune system suppression. Here's the most interesting feature of this experiment. The group that was sunburned and treated immediately with microcurrent for 4 minutes had their immune system suppression reduced by half. The immune suppression went from 63.4% to 31%. The immune suppression was reduced by half 2 weeks after a single 4-minute application of one and only one frequency. What that says is that a single application of a frequency can have a permanent effect on the immune system. 2 weeks, as measured 2 weeks after it was applied. So you have the reduction in swelling, you have the suggestion that the effect of the frequency is permanent in certain situations. So when you stop and think about it, Locks and Cox inflammation is associated with all degenerative diseases and conditions: asthma, COPD or emphysema, irritable bowel, Crohn's, pancreatitis, ulcerative colitis, liver disease, rheumatoid arthritis, and degenerative arthritis are all associated with either Locks or Clocks. And this animal research demonstrates that these frequencies will reduce the agents that create pain and problems for patients with these conditions. So then when you look at injury repair and recovery, you have to ask, or we ask, what would happen if you could reduce all of the inflammatory cytokines in 90 minutes? But then they stopped in the normal range. The medications, if you recall, reduce inflammatory cytokines, specifically interferon gamma, interleukin-1. Those medications reduce them in 1 to 3 months, not 90 minutes. And the problem is that they don't stop in the normal range. They go below normal. So that creates some of the side effects that you see with the biological drugs that reduce the inflammatory cytokines. So we had a study that was done with fibromyalgia patients. Its title is Cytokine Changes with Microcurrent Treatment of Fibromyalgia Associated with Spine Trauma. Not exactly a catchy title, but it was an interesting study. We had 54 consecutive fibro patients. That means we didn't skip anybody. 54 people walked in the room, and we treated all 54 of them with the same protocol. The average chronicity was 9.5 years. It's any place from 1 year to 50 years. And when I presented the first 25 of these patients at NIH in a grand rounds presentation in 2000, I asked the assembled scientists for help with accumulating or getting some objective data about what was changing besides pain. And so Terry Phillips did that research with his equipment at NIH, and that subset of 6 patients did not differ in age or chronicity from the other 54 patients. So 6 would be what, 49, 48 patients, and then we got blood samples on 6 of them. The control patient had myofascial pain from trigger points. So cervical trauma fibromyalgia is about 28% of fibromyalgia patients, or around 2 million people just in the US, not to mention worldwide. What we found through trial and error was there's only one frequency combination that had this effect: 40 hertz on channel A, which is the frequency to reduce inflammation, 10 hertz on channel B, which is the frequency from the list that we got from the osteopath. 10 hertz is the frequency to address the spinal cord as a tissue. So they were treated with one contact at the neck, one contact at the feet. They can also be treated with the pads, adhesive electrode pads on their hands and feet. And as a group, their pain went from an average of a 7.4 to an average of a 1.3 in 90 minutes. Out of this group, 58% of them recovered. The things that we did to get them to recovery, besides get their pain down, was they would have microcurrent in the office, 40 and 10. We developed home units that they could use for treatment at home, and there was a unit available that's no longer made by a manufacturer that's no longer in business as far as I know. But they had home units to keep their pain down to a 4 most of the time. Most of them had physical therapy to stabilize the spine and to do reconditioning. Almost everybody took supplements to help repair their gut, digestion, irritable bowel, to rehab their adrenals. Some of them needed treatment for interstitial cystitis, for which we do have an effective treatment protocol. And this is what happened when we went to NIH. Terry Phillips sent me this data. And interleukin-1 goes from 392 down to 21. This was the first patient I treated. She had had fibro for 3 years, and we treated her the year before with absolutely no effect. It was before we developed the 40 and 10 protocol. So I called her and had her come in, and she was my first blood sample patient. Interleukin-1 went from 392 down to 21 in 90 minutes. And this is the full group of 5 with one control patient. This patient up at the top that didn't respond had spinal cord compression from a really big disc bulge, and her cytokines came down. Her pain didn't come down that well. She came down from a 9 to like a 6. So in our world, that says she didn't respond, but the rest of the cytokines came down, and our averages were an average of 330 down to 80. The thing you need to know about cytokines is, in the medical world, they are hard to change, very hard to change. And when they change slowly. The other thing you need to know is that the normal range is 0 to 25 for interleukin-1, and interleukin-1 stopped at 21. It stopped declining at 21. This patient was completely out of pain by 12 noon, and we ran a different protocol between 12 and 12:35. That's what these numbers are down there, as what time she was being treated. So this is an extraordinary outcome. It is unparalleled in medicine, and it still took us 5 years to get the paper published. TNF-alpha went from 299 down to 20. It likewise is very difficult to change. Average of 305 down to 78. Interleukin-6 went from 200 down to 15. 239 down to 76 was the average. This one outlier drove the range as an average, but look at the similarity in the other 4 patients. They're all very close together. The control patient had myofascial trigger points. She did not respond to 40 and 10, and this was her blood sample data when treated with the frequencies for myofascial trigger points. Substance P is created in the spinal cord and mediates pain transmission from the body up to the brain. And substance P went down by a factor of more than 10 times, from 132 down to 10 in 90 minutes. It's literally unheard of. P-value has 3 zeros, which means there's absolutely no chance it was chance. That it says that the treatment definitely caused the change that you see in the endorphins. Go up by a factor of more than 10 times. They went up from 5.2 to 88 on our original patient. And at about the 30-minute mark, as the endorphins go up, there's this effect that happens. The patient gets kind of floaty. It's as if they've had something to relax them, some substance, and they get just pretty stoned. So at about 11:30, the patient looked up at me and said, "Is this legal?" So they get what we call dwarfed. They get pretty sleepy. By the noon mark, she would not willingly open her eyes. She could hear me. She would respond if I talked to her, but that was about it. Cortisol went up, but it was not a stress response because another one of the peptides that was measured went down, and that peptide, neuropeptide Y, follows the stress response. The cortisol raise follows the endorphin increase, and that's because if you're going to increase endorphins by more than 10 times, you're also going to increase ACTH, which is the brain hormone that stimulates the adrenals to create cortisol. So the pain level went from an average of a 7.3 to a 1.3, which is unheard of. This p-value is published at 3 zeros. The statistic actually has 6 zeros. But the statistician said that publishing anything more than 3 zeros was just showing off. So we published the 3. So all patients experienced pain relief. 58% of them, or 31 out of the 53, experienced resolution of fibromyalgia within 4 months. Tender points went away. The sensitivity went away. The central sensitization went away. Their sleep quality improved. One patient relapsed. She got injured again. And once they relapse, you still just treat them. What's interesting is 13 out of the 53 discontinued treatment for reasons not related to treatment side effects. They all got out of pain, but 13 of them discontinued treatment within 2 and 8 treatments. It takes about 4 months to recover. These patients all stopped treating within 4 to 6 weeks. So they didn't get a chance to reverse their fibromyalgia. This lady had fibromyalgia for 18 years. On December 8th, she had 14 of 18 tender points tender to less than 4 pounds per square inch pressure. January, 1 month later, she had 11 of 18 tender points. February, she had 7 of 18 tender points. Range of motion in her neck had improved by 40%. And the cause of her fibromyalgia was an auto accident that had occurred 18 years earlier. Pain medication was reduced by 95%. Muscle relaxants were reduced by 95%. Sleeping well with no medication. Her IBS resolved. Her asthma got better. And I called her about 6 years after this treatment, and she was still in full recovery. So it is possible to get patients to recover from fibromyalgia. There are about 6 or 7 different kinds of fibromyalgia. This one treatment protocol is useful for this type of fibromyalgia, but we have other treatment protocols that are effective for the other types of fibro. So functional medicine is the modern approach for the old problems in medicine. Functional medicine, naturopathic medicine, integrative medicine, however you want to think about it, it looks at the causes of disease or causes of illness, and it tends to treat the cause with diet and supplements and lifestyle changes. And it's an extraordinary treatment development in medicine. It works really well, but just between us, it costs too much and it takes too long. Patients can expect to recover from, let's say, irritable bowel in 6 to 14 months with taking supplements and being careful with their diet and all of that. With FSM, they recover in 4 to 6 weeks. So FSM is a way of making functional medicine more efficient, more effective, faster, because you increase ATP production and reduce inflammation so quickly. Old problems in medicine: nerve pain, muscle pain, and scar tissue, right? There is no good effective treatment for neuropathic pain in medicine. You can take Lyrica or gabapentin these days. Opiates don't work for nerve pain. Muscle pain, you can take magnesium, you can take muscle relaxants, you can take pain medication, but in general, the treatment takes too long. You can have massage for muscle pain and massage to relax scar tissue. But in general, the treatment takes too long, costs too much, it doesn't work very well. And the side effects are almost more trouble than they're worth. So we actually have a paper published in the treatment of neuropathic pain. Treating neuropathic pain is one of the easiest things that you can do with frequency specific microcurrent. You use 40 hertz on channel A to reduce inflammation and 396 hertz on channel B to address the nerve. There are 20 patients that I did a collected case report out of my little practice in Portland. Average chronicity was 7 years. It's interesting to note that all patients experience pain reduction. First treatment went from an average of a 6.8 to an average of a 1.8, so from a 7 to a 2. That the second treatment, they came in at a 4.8, or roughly a 5, and left at a 1. So they had some residual benefit, and each treatment they came in with their pain lower than it was before. Nerve traction injuries are the easiest to treat. Disc injuries, you can keep the nerve pain down, but you have to get the disc to recovery. In this group, 65% fully recovered, so 13 out of the 20, in about 5 treatments. Disc and traction injuries were the easiest. Disc bulges took about 6 weeks to repair. There were no adverse reactions aside from getting really floaty and kind of stoned feeling. But 25% terminated care prior to recovery for reasons not related to treatment side effects. And some of that can be explained if you think about it. If your pain goes from an average of a 7 to a 0 in 90 minutes, and you've been in pain for 7 years, at the end of that 90 minutes, you have to confront the idea or the concept of who are you if you are out of pain. Frequency specific microcurrent has a unique problem in medicine, and that is we change symptoms so quickly that it creates something like an existential crisis for some patients. It's like, I'm 5 foot 5 inches tall, I have blonde hair, blue eyes, and my pain level is a 7. If at the end of 90 minutes that definition changes because you're no longer in pain, patients have to have time to get their head around that, and not everybody can for various reasons. So neuropathic pain is fairly straightforward to treat. Myofascial trigger points. The first group that I published was 50 cases, published in 1998. It was an average of 5 years chronicity. The range was from 1 to 28 years. The patients, in some respect, served as their own controls because 88% had failed with other treatments. Most of them came in having failed with chiropractic, massage, acupuncture, and medication. Took 11 visits in 8 weeks to get their pain from an average of a 6.8 to an average of 1.5. And it honestly took that long because in 1998, I didn't know what I was doing. I was treating the muscles, and what we really needed to treat were the underlying causes of the muscle tightness. Tight muscles don't happen in a vacuum. In the cervical spine especially, they are usually secondary to facet or posterior joint injuries, disc bulges, ligamentous laxity. Once we figured out to treat the underlying cause, then treating myofascial pain in the cervical spine gets even easier. The lumbar cases were more simply muscle strain. So there were 23 cases published in 2004, 8 years chronicity. The range was from about 2 months up to 20 years. Patients served as their own controls because 87% of them had failed with other treatments. So if they were going to have a placebo response, it is assumed that they would have had it with the other 6 people that had treated them. It was an average of 6 visits in 6 weeks, which is what we see in simple myofascial pain. It's fairly easy to treat the muscles. So 6 visits in 6 weeks to get their pain from an average of a 7 to an average of a 1.5. there are frequencies that dissolve scar tissue. We did a study at a burn center in Springfield, Missouri, and we had patients, 8 patients to start with. It was about dissolving scar tissue in mature burns, which everybody knows are very difficult to treat. Every patient has statistically significant permanent increases in range of motion after 3 one-hour treatments. So what this meant in real time was that the patient's range of motion in their hip or their knee, their ankle, or their fingers were increased when the scar tissue softened and dissolved. For a young girl, it meant that she could smile because the labial fold was no longer scarred down. She could smile. One patient, his goal of treatment, this was an hour a day for 3 days in a row, and they were measured by the physical therapists on Monday and on Friday, and I treated them on Tuesday, Wednesday, Thursday. One gentleman, his goal was to be able to hold a coffee cup because his fingers were so scarred he couldn't bend them to get his fingers into his favorite coffee cup. And we got him able to hold a coffee cup. Another patient, we needed to get his ankles to past 90 degrees, up to 100 degrees, so that he could get into braces and get out of a wheelchair. So it was that was an extraordinary experience. That was in 2003. We did some research at Baylor Medical School. Dr. Wiseman has a technique for inducing adhesions in the abdomen of a rat. We got permission from the ethics committee to anesthetize 3 rats. So he had induced the abdominal adhesions in these 3 rats the week before. And I got through the following week, and you open the animal up surgically. They're anesthetized, obviously. And there is an adhesion that is created that is so dense and white and stiff that you actually have to cut it with scissors. You can't get a scalpel through it. It won't cut. So I tried 5, 6 frequency combinations and got to a combination scarring, 13 on channel A and 77 on channel B, and one and only one frequency. That one frequency alone made this white, dense, tough, stiff scar literally turn clear and liquefy. It turned it to mucus, snot. It was incredible. So the frequencies that reduce scar tissue are incredibly effective, especially in sports injuries. So when you use FSM with athletes, so this he was an Olympic swimmer, is being treated by our sports FSM sports instructor, Kim Pittis. And so you combine the frequencies with manual therapy. When you're loosening the connective tissue that creates scar tissue, while you're loosening it, you do manual therapy to increase range of motion. So FSM is a tool that lets you or your therapist do what can't be done otherwise. So FSM is a new tool. The frequencies were developed by osteopaths in the early 1900s, as we said before. I don't know how they were derived. I don't know the mechanism of action, but I'm a clinician. I honestly don't care. They either work or they don't. There are some frequencies I took off the list and I don't use anymore because it didn't work. So they have everything we do in frequency specific microcurrent has been clinically verified over the last 20 years. So between 1995 and 2016, hundreds of thousands of patient visits have verified the effect of the frequencies. There's one frequency combination. The only thing it's good for is shingles. Shingles in the prodrome and shingles in the acute phase. This was actually Dr. David Simons, who wrote the trigger point manual. He had shingles in the ophthalmic branch of 5. He was 85 years old at the time. There's one frequency combination that's effective for shingles, 230 on A, 430 on B. Takes about 4 hours of treatment. That's what he had. 2 hours one night, 2 hours the next night. He was pain-free within 20 minutes, actually. there was no return of pain. And after the first 2-hour treatment, the next day, these blisters had already broken out on his head, and they had started to dry up. And at the end of 2 to 3 days, they were completely gone. So this was published in Practical Pain Management in 2010. So how can specific frequencies change specific conditions in specific tissues? So the short version for the non-medical folks is that your biological tissue is made of really biochemicals that are glued together or held together to make your skin or your fascia or your bone or your muscle by electromagnetic bonds. Your body is made up of molecules and atoms and subatomic particles, the same kind that you find in the linear accelerator in Chicago. And all of these chemicals are held together by electromagnetic bonds. Every bond, every chemical bond, every mechanical bond has a frequency at which it resonates. If you can find that resonant frequency, you can change the state or the status of the tissue. So your body is essentially an electromagnetic system that looks solid, but the cells function as if they are a semiconductor network because the way that water is organized inside the cells. Lots of books you could read about that, but Cells, Gels, and the Enzymes of Life is my favorite, that it explains how water makes it into a semiconductor. Semiconductors are just like your computer. They convey current, charge, and information by the way the current and the charges move throughout the system and influence communication in the cells and the cell membranes. In your cells, the membrane receptors in the cells are sensitive to signaling. So the messages come to any given cell. This is an immune system cell. Messages come to any given cell from the circulation, from the environment, and some sort of substance, a drug or nutrient, lands on this receptor and changes its configuration. The receptor is connected to the inside of the cell by fibers, special kinds of fibers and chemicals called kinases. It changes the genetic expression in the cell, and that changes what the cell does or produces. In this particular case, you have an inflammatory signal that hits the cell, and that causes this cell to secrete pro-inflammatory cytokines. So this receptor change cell function and cell signaling. So we are used to drugs or nutrients that act like keys in a lock to change these membrane receptors and change their cellular function, right? We're used to that. Keys, locks, this is how drugs and nutrients work to change cell function. Well, the frequencies act like your key fob that change that lock with an electromagnetic signal. It's not a drug, it's not a nutrient, it's like your key fob. It changes it with a signal. So it changes cell membrane protein configuration and cell function electromagnetically, right? So it reduces inflammation with a signal that changes this receptor and changes what the cell is producing. That's why the cytokines all stop in the normal range. But the frequencies act as if it dissolves the scar tissue cross-links that holds scar tissue in a shortened configuration. It acts as if it disassembles the virus. There's no way to treat shingles in 2 hours or 4 hours. There's no way to do that. This frequency is consistent. It's been in use since 1998, and we haven't found anybody it doesn't work on. It stops shingles. Only way that can happen is if that frequency is doing something to dissolve the virus or to change the receptor so that it's not susceptible to the virus, right? The frequencies act as if they change cell signaling to reduce inflammation. So it's like the frequencies tell the cell what to do. The current gives the cell all the energy it needs to make the changes you want to make. So I have a textbook out on how to use FSM, Frequency Specific Microcurrent in pain management. It's been out since 2010 for those of you that are practitioners, and actually even a lot of patients have read it and seem to enjoy it. It tells you what frequencies to use, what to use them for, and how to decide what to treat with what frequencies. Frequency Specific Microcurrent is taught in a 3-day seminar. It's actually 3 days and 2 hours, Thursday night, and then Friday, Saturday, Sunday. It's a very hands-on workshop. We have 6 practicums. There's 500 and some odd slides. It is like taking a drink of water from a fire hose, but truth to be told, I don't know what to send people home without on Monday. So we do physical medicine, we do visceral medicine, we talk about how to treat PTSD and concussion and traumatic brain injuries and emotional situations or issues, and how to treat fibromyalgia and myofascial pain. So that's all included in the seminar. And if you're a patient, I recommend that you find your favorite practitioner who's allowed to use electrical stim as part of their practice, and you tell them about this seminar and help them to find us, because FSM is a new tool that really solves the old problems associated with medicine, health, and recovery. It's fair warning though, frequency specific microcurrent will change your life if you're a patient or a practitioner. It will change your practice if you're a practitioner, and it will change your outcomes. And once you've seen what you see during the seminar, when you read the book, you can't ever go back. So it changes your life, your practice, and your outcomes forever. And I warmly invite you to join us at a seminar. I encourage you to purchase the textbook, Change Your Life, Change Your Help. We still have some spots for the next course seminar in Cleveland in January. As a Christmas present, FSM is offering a $200 discount off the core seminar, and that code that you put in on the website is CORE, capital CORE 200. This coupon is good until the end of the year. The Cleveland seminar is at the Cleveland Clinic in January. I think it's the 21st. If you're really serious and want to just dive into the deep end of the pool, come to our advanced seminar. Actually, come to the core seminar in Las Vegas first, then take a couple of days off, and then come to the advanced seminar and our FSM International Symposium. I have speakers from all over the world, Germany, Australia, the US, England, and you'll get to see the newest results in FSM research. So I wish you well and good health, good healing. And you can email your questions if you have questions at the end of this presentation. Email your questions to contact@frequencyspecific.com. Thanks for listening and have a great day.